Tani. I'm here to talk about high blood pressure uh, with the iHeart family and to let you know the different ways that you can prevent it, risk factors, and just to have a discussion to inform you on how to get your health better. What is high blood pressure? High blood pressure or hypertension is blood pressure above 140 systolic or 90 diastolic. What does that mean when we say systolic and diastolic? Systolic is when your heart is contracting, and when your heart is contracting, it is working against a pressure, and when that pressure is above 120, we consider that as being elevated up to the level of being hypertensive or having a high blood pressure. In diastolic is a relaxation of the heart, and for the heart to relax, it has to relax against a pressure. So the normal pressure for that is 80. When you start having above 90, then that becomes problematic, and that's when we start to diagnose you with high blood pressure. Usually it takes about 2 or 3 doctor's visits for that to be done. So you go to your doctor and your blood pressure, some people get nervous, so sometimes blood pressure is elevated for no reason or just because they're nervous being at the doctor. So it takes 3 visits for doctors to be able to say, okay, now we're worried about your blood pressure because it's constantly elevated above 140 over 90. Okay, now we're going to talk about the risk factors of high blood pressure or hypertension. We're going to break this down into 2 categories. The 2 categories that I like to break these down are controllable risk factors and uncontrollable risk factors. Now, the uncontrollable risk factors are things like your age, things like your race, and things like basically your age and race are those things that you can't control. We see that once you get older, your blood vessels tend to calcify. Your aorta, especially. The aorta is the main blood vessel that takes blood out of your heart. And when that vessel starts to calcify, it reduces the elasticity of the heart. We know that the heart has an elasticity. What that means is the ability for it to expand and contract without any issues. So when we get older, because of calcium deposit and because of our cells, our body's aging, that elasticity that the heart has gets lost. So your heart, being a pump, starts to use more pressure to pump to do the work that it's been doing when you were younger. So when that happens, the blood pressure goes up and you develop what is called idiopathic hypertension or essential hypertension. Now, it is known that people of color are more predisposed to having high blood pressure. Maybe due to the diet, maybe due to genetics, but we know that most people of color have a predisposition to having high blood pressure. So those are the uncontrollable risk factors that we can have with high blood pressure. Now, the controllable risk factors are things like cholesterol. Now let's talk about cholesterol. How does cholesterol become a risk factor for hypertension? What cholesterol does, it is over the years with a bad diet, it starts to deposit plaque on your blood vessels, and because of that, now the vessel becomes thicker, and when it becomes thicker, what happens is the resistance of the vessel, is increased, and because of increased resistance, you're gonna have increased flow. The heart is gonna use more power to pump blood against this resistance, and that's what you call atherosclerosis. Basically, the vessel is lined with plaque, and it can what used to be like this now becomes like this, and you have to use more pressure to pump blood through. And that's just to make you understand what happens over time. So that's why cholesterol is important. When you go to your doctor, just don't get the results and leave. You have to ask them what these numbers mean, how you can adjust that. Another risk factor that is, I would say, controllable is your diet. A lot of us we eat a lot of, I don't want to say fatty food, but we eat a lot of meat, processed foods, a lot of carbs, and these things basically are not good for you, because again, it goes together with the cholesterol. When you have increased cholesterol, increased fats, these deposit in your blood vessels, and eventually, with time, again, your heart, the pressure that your heart used to pump in a vessel that had little resistance, now with high resistance is using more pressure. Another thing that predisposes us to high blood pressure is our habits. Okay, habits like smoking tobacco or cigarettes. You also talk about alcohol consumption, and it's interesting because a lot of people don't understand how alcohol plays a role. It's often said a little bit of wine is good for your heart, but you have to understand that with time, what happens with alcohol is alcohol is a central nervous system depressant. So what that means is it reduces your heart rate. And when you're a chronic user of alcohol, when you stop using it, you have something that will happen, which is like a rebound hypertension. Your blood pressure your heart rate has been so low under the influence of alcohol that when you get off of it, now your heart, it starts to beat faster, and that generates generally a high blood pressure. So that's in a nutshell, that's how alcohol plays a role over time in high blood pressure or hypertension. We also have things like obesity. How does obesity play a role in high blood pressure? Now you have to understand that, again, obesity, when you think about flow, the things that influence flow are viscosity and length, and the length when you talk about physics. So if you take that physics and you bring it into medicine, you would see that with obesity, when you have an increase in length, obesity, basically your blood vessels now are longer because they have to supply that extra tissue that you're carrying around. And because of that length, that increased length, what happens is the flow has to increase to compensate. And when the flow increases, what happens is the pressure has to go up to make sure that extra blood is being reached out to that extra tissue. And that's how obesity plays a role. Basically, you're carrying around extra tissue. Your blood vessels are longer, so obviously it's going to take more to push blood into that extra tissue. So that's how obesity would increase your blood pressure. We also talked about something like diabetes. Now these are related. So you would notice that most patients that have diabetes will end up with hypertension if it's uncontrolled. How does that happen? Well, when you think about diabetes, you think about sugar. You think about sugar in your blood. So if there's sugar in your blood, that makes your blood thicker. It's more viscous. So because your blood is more viscous, again, taking that formula, talking about the flow, you see that the flow reduces. The flow reduces, and what happens in order to compensate for this flow? The pressure goes up. So you think about like an inverse relationship where you have increase in viscosity, you have decrease in flow, and something has to compensate. So you have the pressure now goes up. That pressure is your heart pressure. The pressure, your blood pressure, has to go up to compensate for this increase in viscosity, which is caused by sugar in your blood or diabetes. That's how diabetes becomes a risk factor. And this also goes for things like cancer. You see that in cancer you have multiple cells, cells multiply in cancer. So when those cells multiply, what feeds the cells is blood vessels. Blood vessels have to get to those cells. So it's the same kind of principle like obesity, where you have an increase in length or increase in blood vessels being formed. Now what happens is a decrease in flow and a compensatory mechanism that will cause an increase in blood pressure. So those are the things. So those are the risk factors. Cholesterol. We talked about habits. Tobacco smoking, alcohol consumption, obesity, diabetes, cancer, and just diseases like that will predispose you to high blood pressure. So that said, let's talk about how we can prevent. How can we prevent these things from happening, or how can we reduce the incidence or risk factors or predisposal to developing high blood pressure? The number one thing is exercise. I just recommended that we do at least 30 minutes of a workout a day, aerobics preferably, just walking 30 minutes, or running 30. If you can do more, the more the better. But you realize that you see that in athletes, in professional athletes, if you measure their resting blood pressure, it's so low. It's so low because you see that the heart is a muscle. Think about your muscle. When you work out your muscle, when you start to lift 20 pounds, for example, it may be heavy at first, but when you keep working out, what happens is with time, your muscle develops to the state where 20-pound weight is nothing. So you can just lift it just like that. And then it would actually take more for your muscle to fail. It would take more than 20 pounds for your muscle to fail once you have adapted and worked yourself up to that level. It's the same thing with the heart. The heart is a muscle. How do you work out your heart? You work out your heart by working out, exercising. Because when you get your heart strong, what happens is it takes less pressure or less effort for your heart to distribute, to pump blood to the rest of your body. So that's how exercise, I know a lot of doctors talk about exercise, but no one ever really explains how this is beneficial. You have to think of it as a muscle. You develop a muscle, and then it takes less for that muscle to do what it would do if it wasn't developed, basically. So that is how exercise helps. Obviously, weight loss goes with exercise. If you're obese, BMI over 30, or I don't know what the numbers are, but it'll help to lose a little bit of weight. It always helps. It's beneficial to your health, beneficial to your blood pressure. We have also, restricting these things, these habits we have. Stop smoking. Not only does smoking predispose you to, we talked about risk factors, but this is just going back, predisposes you eventually to cancer. It has carcinogens. It would help to reduce your blood pressure if you stop smoking. Alcohol, we already talked about that. Reducing the rate or the consumption of alcohol will, in the long run, help with your high blood pressure. Now let's talk about, you can ask yourself now, we've talked about all these things. So what happens if I decide to live my life without taking care of these things? What happens if I ignore these things and just live my life and be happy? After all, pursuit of happiness is why we're all here. Now, these are the complications that can happen with uncontrolled high blood pressure. Okay, the number one thing is a stroke. What is a stroke? A stroke is basically your heart has abused your blood vessels so much. Remember we talked about atherosclerosis and cholesterol depositing in your vessels. Now that vessel is thickened and it keeps getting hit with this wave of blood, with the heart pumping through this little tiny thing. Think about being in the beach and you have, and the water waves are pushing, kind of pressure over time, what happens is that blood vessel may not be able to hold that pressure. And what happens is the blood vessel will burst. And when that blood vessel bursts, if it's in your brain, that's what we call a stroke. And now that brings about a whole, a stroke is a whole different topic. I mean, we can talk about that another time. But you've seen people with strokes. They lose the ability to walk and talk sometimes. So that's the number one complication. You can have a hemorrhagic stroke, and sometimes this is a death sentence. That's why it's important for us to annually go to the doctor, do your regular checks, check your blood pressure, know your baseline. Some people will function practically okay with a blood pressure of 130 over 80. Some people are lower than that, but the goal is to be lower than 120. So know your baseline, and so that you can now put things in place to lower this blood pressure. We don't always want to depend on medication. Medication is good. It's going to prevent you from developing these things. But if you don't change your habits, if you don't change your risk factors, what happens is you keep taking these things to prevent something that you can prevent. Basically, you keep taking medication when you can stop smoking or lose weight and get off those things. They all have side effects. But that's going outside of what we're talking about right now. The next complication we have is, we all know people that have had heart attacks. Again, it goes to the same thing. Your heart is pumping so fast that you develop, your heart is unable to supply itself. And what happens? The blood vessel in the heart dies. What happens when your blood vessel dies? The muscle, you get a muscle cramp. You get an infarction. Basically, the tissue is dying, and that part can't function. And if your heart can't function, what happens? The next thing is your brain goes, and you become a vegetable. So, or you have cardiac arrest. These are all complications of increased blood pressure, hypertension, uncontrollable hypertension. Some people develop heart failure, congestive heart failure and when I look at congestive heart failure, I think about things like smoking, which you eventually develop COPD, chronic pulmonary diseases, that will eventually affect your heart. Your heart fails because you're not being oxygenated enough for your heart to function. So these are things, they're all linked together. They're all linked together. Sometimes another complication, you can develop kidney disease. Again, it's the same kind of concept. You keep pounding this pressure into your little kidney. One day the blood vessel bursts and you have an infarction. You could have, you end up needing to have you develop renal artery stenosis, which means your blood vessel in the kidney is closed, and you have to go through some kind of procedure to open it. So basically, you can develop kidney disease. It can also affect your eyes, and the concept basically all these risk factors is the same. It's just a blood vessel that is getting so much blood that it bursts, and it bursts. Your eye goes, your kidney goes, your heart goes, you develop a brain aneurysm or a stroke, and you have even in some people that smoke, it's recommended that they people that have been smoking at age, I think it's 60 or 65, they're supposed to check their carotid arteries to make sure they don't have any sort of aneurysm, because what can happen is you can have a dissection. Basically, a dissection means you cut through your aortic valve, your aortic blood vessel. And when this happens, this is the major artery that takes blood to the rest of your body. That is instant death. So that is why we talk about hypertension, because there are things that we can do to prevent these complications. And these are just a few complications that, that I can think about. There are more complications, but basically what happens when you keep pounding fluid against a blood vessel, eventually it'll burst. And anywhere in your body that blood vessel is being abused like that, you're going to have a complication. You're going to have some kind of bleeding. So if it's in your brain, you have a stroke. your kidney, you have an infarction. If it's in your eye, you have what you call retinal hemorrhage. Basically, you can go blind. So these are just a few risk factors or complications of having uncontrollable high blood pressure. What does health mean to me? Well, health is life. iHeart family, we talked about diet and hypertension. Tomorrow is Thanksgiving, so we're gonna give you guys some suggestions on a dietary approach to stop hypertension. It's called the DASH diet. We have here on the table, as you can see, we have, this is all vegetarian, of course. We want to encourage a plant-based diet to stop hypertension for those who already have. And sometimes we think about, you know, plant-based, we think about it's bland, it's tasteless, or, I mean, you can make your food tasty. I mean, look at this, it looks beautiful. We have some carrots and some green beans. We have chickpeas. Looks like a stir fry, you know, it tastes really good. We have baked lamb chops. Important to bake your food, to bake your meats. A source of protein if you want to dabble a little bit, but it's baked. And then we have you know, you can use this and replace mashed potatoes with some cauliflower. This is not mashed potatoes, so this is all plant-based. It's healthy, looks good, it tastes good as well. We also have here we have some kale and shrimp, some seafood. You know, so you can always incorporate a plant-based diet to help you with hypertension. And even if you're already trying to prevent it, make it a habit of having vegetables in your diet. This is highly recommended. The DASH diet, dietary approach to stop hypertension. And with time, of course, you know, you get used to this, especially us people of color. We want to have our, you know, our chicken, you know, and beef. And to be honest with you, those things, first of all, the meat is toxic. Watch, I'll make a recommendation for you to watch. It's called What the Health. It's on Netflix, I believe. Watch that show. It'll change your mind. But we're not here to promote What the Health, but it's a good movie for you to watch, or a documentary. But we just want to encourage our iHeart Health family to try something new. Try plant-based diet. Get recommendations. We're gonna have a recipe of how these things are made, so you can try them at home and you can taste them and you can incorporate them. Start, if you have kids, let them start eating healthy so that they grow up with a healthy habit. And you know, and that's what we're all about here, getting healthier and walking to fulfill that healthy eating and control our health, basically. Thank you, and thanks for having me, iHeart Health. Look forward to our expo coming up, 24th of February. Please come and experience this stuff. Experience how you can get healthy. Sometimes people just don't know. People want to get healthy, but that avenue is not there. You don't spend enough time at the doctor's office. The doctors don't have time to tell you what to eat. They'll tell you eat healthy. But how do you eat healthy? This is why iHeart Expo, we're here. We've come here to educate you. It's free. Come out, show some love, meet some people, ask questions. We have a lot of professionals. We have doctors, nurse practitioners, you name it, pharmacists. And let's have a good time and learn how to take care of our bodies. Our bodies are a temple of the Lord. So we got to take care of this body while we're here. All right. Thank you, iHeart Health, and enjoy. Happy Thanksgiving, everybody.